Hi, this is Sonia again. I haven't made a video in a long time. I think the last video I made, I was talking about the problems I was having with high insulin, and we really didn't know for sure what was causing it. Well, in June, I got a whipple done, and they took out a third of my pancreas, a third of my stomach, the duodenum, and they look at it all under pathology. And it took pathology 3 days to find out what my diagnosis was. Normally pathology comes back by the end of surgery, like especially with a whipple, because they're usually like, okay, well, this is the tumor, you know, and you got the margins. Well, they didn't do that for 3 days, so the doctor just did the whipple, he finished, he closed it up, and then in my case, my doctor actually went on vacation because he was fitting me in to his very busy schedule before he went away. So by the time he comes back, I've had a very traumatic hospital stay, which I'll talk to you guys about later. Central lines in the liver, being given medication that I'm allergic to, which made me hallucinate. It was horrible. But anyway, he comes back, and by then they've figured out my diagnosis. It's called Nesidioblastosis, or islet cell hyperplasia is a more common, a newer term that they use, but adult onset Nesidioblastosis is the term for it. It's the for infants, it's a pretty common reason why infants would have low blood sugar. So if I had been seeing a endocrinologist as a baby with all my problems, I probably would have been diagnosed right away, and I wouldn't have had to wait 5 years for a surgery. Well, and really I had to wait for my chronic pancreatitis to get bad enough and require surgery to even get the whipple, which gave me this diagnosis. So as I'm sure you've noticed since my last video, I've lost like 60 pounds because extra insulin gives you extra weight. And I can say that it was one of the hardest things to go through, to have people not believe you that you're not eating a lot of food and you're gaining weight. And my endocrinologist absolutely believed me, and I have notes back from my surgeon from that time period which says he believed me too, but he knew but insurance wouldn't cover he thought it was an insulinoma, and insurance wouldn't cover surgery. My private insurance wouldn't cover the surgery without a visible insulinoma, and there was no visible insulinoma. Because there was no insulinoma, it was Nesidioblastosis. So June is when I got the whipple, and it was a really hard, painful recovery, made worse because I had about, I don't want to put a number to it, but it was more than 5 pancreatic leaks, which the surgeon had prepared me for and told me was probably going to happen. So eventually, there's a long story of how I got to this point too. Eventually I used my surgeon's cell phone number to text him like, hey, what's the plan? You know, I have this diagnosis. The endocrinologist says I need my pancreas removed, but when I try to talk to the PA, I don't know if she doesn't understand or what, but you know, I gave her the cell phone of the endocrinologist, and instead I get a call from endocrinology saying that they got a new referral, like a new patient referral for me to go see them as a new patient. And I'm like, I'm already a patient there. Anyway, thank goodness I did text him, because I got a response within 2 hours from my surgeon, and I had his cell phone number from when he did my kidney auto transplants 5 years ago in 2020. Anyway, so he messages me back and he's like, oh, I did already talk to your endocrinologist, and he and I both agree that you need your pancreas removed. I just need to know if you were on board with the surgery. And I'm like, yeah, I'm on board with the surgery. I've been telling the PA that, you know, that I needed to talk to you to figure out what our next plan of action was. And she was like, well, good luck doctor shopping and finding a surgeon who will do anything 10 weeks after a whipple. And actually, when I had my appointment with the surgeon, he said that he had been ready to do it since 12 weeks after my surgery. So I waited for an extra 2 months while I had pancreatic leaks because the PA wouldn't let me get an appointment with the surgeon. So in the text message, I told him, you know, I can't get an appointment with you. And he said, well, I'll talk to my staff, and it was like a Friday. So on Monday, they'll call you to make an appointment to make sure you're on board with the surgery. So we got that appointment. I went to Utah for the appointment. My husband was unable to come because he was at work. One of the few times he couldn't get out of work, but my aunt and my best friend came with me, and my husband was on the phone, had a lot of support during that appointment. And good thing, because it was very stressful to have to talk about, you know, what my life is going to look like after my pancreas is removed. And so now it is February and I have no more pancreas. This has not been an easy recovery either, especially because the pancreatic leaks made it so when the surgeon opened me up, he said all my organs were covered with a pinkish looking material that looked like bubble gum, but was as hard as cement. So he basically had to go in blind, meaning like he could not tell what was intestine versus stomach versus liver. Like it all was just covered with this pink crap, he said, which was made by the pancreatic leaks. And I had complained about the leaks. We knew the leaks were there. So when I apologized to him when he told me about the leaks, I said, I'm sorry. I'm so sorry, and, you know, thank you for still doing the surgery. And he was like, why are you apologizing to me? I'm the surgeon who did the surgery that caused the leaks, that made the scar tissue. So I don't know, my surgeon's just a stand-up guy, and a lot of surgeons would have just closed me back up. And because it puts them at risk doing a high-risk surgery, because if something happens, you know, it's on the record. And he didn't do that. He didn't close me back up. And I'm very grateful, because he knew that I would die because I was being poisoned by the excess insulin. So I went from having extra insulin and daily low blood sugar to, it was a very weird experience actually to talk to a diabetic educator before I got diabetes. I wonder how many other people have ever, you know, talked to a diabetic educator and been like, next week you're gonna have type 1 diabetes. Today I don't, but next week I will. Well, we did go through that before the surgery, and now I've got type 1 diabetes. I would say quite close to being like uncontrollable type 1 diabetes. I need a lot of insulin. Well, I don't know what the uncontrollable means as far as like an endocrinologist, but when I went home, I'd say they sent me home too early. I was not on solid food yet when they sent me home, but that same PA who wouldn't let me see my surgeon, she was not giving me enough pain medicine, and I knew that at home my pain doctor would take better care of me than she was. So I allowed her to discharge me when she wanted to, even though I felt like it was too early. So anyway, I was not on solid food yet, so they sent me home on 10 units of insulin a day, and now my base is 16 a day, plus anytime I eat something, you know, for every 10 carbs I have 1 unit of insulin. So I still don't have a insulin pump. I was told by my diabetic educator that I'd have to wait 6 months. Well, I just had my appointment with the endocrinologist, and he was like, well, we can try starting it earlier, you know. So we talked to the diabetic educator about that, and she was like, well, you need to make an appointment to start the process. And I'm like, really? We were waiting on an appointment? I'm like, it has been very hard, especially because of how much weight I've lost. I don't have that much fatty tissue to give the shots into. It hurts a lot. And that when I do find a spot, usually it's on the back of my legs, my thighs, that has fat, it doesn't hurt. But because I'm like losing so much body mass, like, and on my stomach, I looked at the surgical reports, and it talks about how even like the fatty tissue on the other side of my skin, like on my stomach, was dissolved from the pancreatic leaks. This is why I don't have a lot of, like, all the leaks made it so I don't have as much fatty tissue as other people. So giving myself shots sometimes like 7 times a day is a lot. So we're starting the process of a pump, and I believe it will be approved before 6 months, because what are they going to say? I have to wait 6 months to see if my pancreas isn't going to grow back? You know, that's stupid. Anyway, I'm looking at how long I've already been talking, and talking more than I thought I would. I'm not really feeling very good right now. Like, it's the Super Bowl. My husband and my son are at family member's house for a Super Bowl party, and I was invited but I'm not gonna go, and my daughter's asleep right now too. I'm not sure if she has a virus, and well, she's having some health problems actually. She's currently not in school right now. School made the decision to have us unenroll her so we could get some of her diagnoses under control. Oh, I can't even tell you, there's so many things going on right now. So she's asleep right now, and she needs to sleep. And so I stayed home with her, and initially I was thinking that like halftime I'd wake her up and we would both go, but I'm not feeling well enough, and I think it's probably best for her to sleep. So I decided, you know what, why don't I make a YouTube video, because I promised people that I would. And yes, I don't feel good right now, but I don't look especially awful right now, because yesterday I curled my hair, and I mean, I just woke up and it does look like this when I wake up. I'm pretty lucky that way. And so I was like, I can make a video, and the house is quiet. And you know what else is kind of funny, speaking about like how my hair just stayed curled and I woke up this way? When I was in the hospital for my whipple, I had to get lots of CT scans before they found out that the central line, this is the scar from the central line, it's all poofy. Before they found out it was in the liver, I had to do a bunch of CT scans, and it hurt so bad to lay flat. So they were trying to talk to me. And anyway, they were asking me about my home life, and I told them, you know, I have a husband, and I have at the time he was 15 now, of a 14-year-old. Oh, I shouldn't have touched it, it hurts. A 14-year-old and a 12-year-old at home, and they literally didn't believe me. They were like, you're too young for that. And I've had a lot of people at the hospital staff commenting that I don't look my age. I'm 37, yeah, I'm gonna be 38 this year. This is my natural hair color, so no gray hair either. So the family joke has been that my body forgot to age while I've been sick for the last 16 years. But you know what? I will take it. And anyway, so I will give you guys more updates later, and hopefully I will, I'm still having a lot of nausea and pain, which I kind of shouldn't right now. So I'm getting a CT scan on Monday. It was supposed to be last week, but I was a little bit constipated, and I was like, if I do it now, I'm just gonna get the result. You're constipated, you need to go to the bathroom, and everything will clear up. So I rescheduled it so that tomorrow's Monday, so that they can't say that I'm just constipated. And if there is a complication from surgery, hopefully they'll find it, and then we'll get it taken care of. And I really do hope that they figure out what's going on, because I have missed the last 16 years of life. The last 5 especially, I've literally just been unconscious for about 16 hours a day. My husband would just come and check if I was breathing, because there was nothing else we could do. Anyway, my son made the comment to my husband that he doesn't remember me ever being this well, which is kind of sad to me, because my kids don't remember when they were toddlers. But I mean, until the last 5 years, I was always the class mom and everything. I was still a pretty good Mom, even though I was real sick with this pancreatitis crap. And that's my dog barking. That's my cue to go. But it's still a good thing. My son said, you know, he doesn't remember me ever being this well, and I'm still nauseous and having to spend a lot of time in bed. So that's good news. And I'm gonna go take care of that, make my dog stop barking. But it was good to chat with you guys, and I'll talk to you later. Bye.